So what we want to do now is that we want to jump into kind of the case study we want to look at. And as we were preparing for this, we were looking at probably 5 to 10 different examples of people that have been compromised that we've been involved with in one of our 3 organizations that are represented here. And as we were going through this, it felt like we were doing forensic files. So we kind of wanted to explore this almost in that style. So the case that we have, I'm going to talk about the victim here. Names have been changed to protect the innocents. But the victim itself is a multi-provider healthcare facility and surgical center. And the scene, just to kind of set the stage so we know kind of the numbers that we're talking about, the scene had about 75 workstations, about 12 servers. So it's not a huge practice. They're hosted their electronic medical record system and software is hosted on-site, on-premise. And they had an on-premise email server. And they had managed about 44,000 patient records. So what we want to do is talk about what happened before the breach. And I'm going to have Steve kind of introduce kind of where it was before the breach occurred. And then we'll talk about what happens when the breach was executed. So Steve?
Yep, great. Thanks, Tim. So, we chose this client because, we thought they're a good representation of a company that wasn't what I'll call complacent. Right. We do have run into people who, their approach to cyber is, hey, I'll just get a cyber policy and whatever happens, happens. Right. This was a practice that was, pretty mature for their size, took it seriously. They were representative of a typical practice that's, going through COVID and having some financial challenges. So, of course, they were concerned about cost and balancing that balance act between what they invest to protect their practice, versus what they spend. So we thought it was a good case study because, some people when they get attacked and you look at the history, you say, well, they kind of earned it. This practice is kind of in the middle, and I think representative of a lot of healthcare practices that are out there today. So when we look at this practice, they dotted their I's and crossed their T's in terms of taking HIPAA. They took it seriously. They performed their annual risk assessments. They had current policies that they reviewed every year. They did have general liability insurance. They had $1 million of cyber insurance. But they also had, as I said earlier, they were concerned about cost. They had a history of riding out, their technology investments as long as they could. In terms of technology deployed, they did have antivirus and what we call EDR, endpoint detection and response. They had their laptop encryption. They had spam filters. They were using a VPN. They had regular patching in place, and they had cyber training program for their end users, right? So when we talk about preparing for something like this, we talk about, people, process, technology. And in this instance, right, they had their people trained, right? They took it seriously. They had processes in place. To prepare the practice in terms of policies and procedures. And also within process, they had a process for what to do in event of a breach in terms of going to a manual process, right? What happens when the EMR goes down and now I'm stuck in a manual mode? They had a process for that. And some of the technology that they didn't have deployed, right? They did not have multi-factor authentication. They were not doing dark web monitoring. They did not have SIM and SOC, file monitoring, or end user password vaulting. So that's kind of, Tim, a rough summary of where the practice was at, before the incident occurred to them.
So it sounds like this practice was trying to do all the right things.
Yeah.
And they knew that they were deficient in some areas and they were working towards resolving those. Do you think that this was a strategic part of their business plan, or were they just reacting and responding to as things came up, or was this a serious part of what they're doing?
No, I think this was, the practice was strategic in terms of, where they were going with their business, right? We talk about helping practices in terms of their ability to run, grow, or transform, right? This practice understood that. They had strategic plans in place. As I said, they were fighting some other, financial challenges. So, they could not, from their perspective, implement all the security technology that came as recommended. And there's, 2 factors to that, not just financial, but also sometimes there's an impact to the providers, right? There's this perception, if we go a little too hard on security, how's that going to impact workflow? But there was, they didn't have their head in the sand. They were engaged in having conversations about this.
So Gary, do you see that's the case, that a lot of clients that are, facing breaches and, being compromised, do you feel that they're doing the right things in many cases, or it's gotten more mature where people are trying to do the right things?
I think you have a combination of both. I think you have
Okay.
practices that are still operating the same way they operated in 2017, 2018, maybe even have the same technology in place. I know it sounds crazy, but we see that, 5, 6-year-old devices. I also believe that there's this mindset of, we're small to medium. What are the odds we're going to get hit? So why should we spend money on this, meaning security technology? So I think there's a good chunk of that. And then I think there's also just bad luck, not having proper policies and procedures in place is another issue. So look, there's a lot of circumstances. I would say in most of the cases we've dealt with, after performing the forensics investigations, most of the attacks were in fact preventable. If the victim had taken the advice of their IT or managed service provider and implemented some of the technologies that they were recommending, a lot of this stuff is preventable. And we'll talk a little bit more about that later on. But yes, I think that's the case.
It's kind of like your health, right? There's a lot of diseases that are out there that kill people on a day-to-day basis that the root cause is preventable, right? Our lifestyle, the way we eat, the way we, our lifestyle built around that could have prevented these diseases and ultimately the death of someone, right? So same thing happens in the cybersecurity space as well. So let's talk about, so this client was trying to do everything correct. They invested time, energy, and money to do this. They were a mature organization looking at how they could actually move from this run, grow, transform kind of model through that model. Let's talk about what happened when the actual compromise happened. And Gary, would you mind walking the team through kind of what you saw?
Hey, Tim, before you do that, I just want to jump in. If you could go back
Please.
to that slide. Steve had shared with me previously that this organization, not only did they have a cyber insurance policy, but they also tried to tap into their general liability policy. And for the folks who answered that question earlier with respect to the poll question, most general liability, most property policies do not contain cyber coverage. So, if you think that's the case, you should probably be concerned because there's throw-in coverage. So, for example, Cincinnati Insurance is one that provides sometimes $50,000 or $100,000 of coverage, but you really need to understand what the coverage trigger is. And what I mean by that is, as an example, Cincinnati's policy, the data has to have a direct custody and control. Think the cloud. If you're in the cloud, it's not covered. The info cannot be stored or disposed of recklessly. That's a vague term. Think about when you have the claim, you got to try to trigger that policy. Is somebody going to come back and say you disposed of or stored that information recklessly? It only covers reputation repair and not loss of revenue from brand harm, or no post-remedial breach services. These are all things, as an example of that inexpensive $500, $600, $50,000, $100,000 throw-in policy that is not going to help you when you have a breach. So just be aware of that.
Yeah, that's a good point. So I think just, kind of looking at this, it's not just about having the insurances in place, really knowing what's covered and what's not covered in is really, really important part of the process. Right. Do you agree with that, Brian?
That's right.
And Brian, I also want to share with you some of the experiences we've seen. We've seen victims with, say, $250,000, $500,000 worth of coverage, but when you look at what is actually covered, a majority of that money goes towards patient notification, right? It doesn't go to the cleanup of the event, right? The paying of the ransom, the forensics costs, the downtime. So a lot of healthcare entities are like, well, I have a $500,000 policy, but they actually don't know what's in it. And I think that's, to your point, everyone on this call needs to really understand that, before they get into a situation and think they have a $500,000, the ransom ends up being $600,000, $700,000, and you only have $10,000 that goes towards the ransom payment. That's going to hurt.
A lot of times you get what you pay for. So just keep that in the back of your minds when you're, in the process of purchasing insurance. If it sounds too good to be true, it probably is.
Yeah. Absolutely.
You don't want to find out after the breach that you're not covered where you thought you were. Gary, why don't you kind of walk through this and let's kind of talk about what happened with this particular case.
Sure. And this is very similar to most attacks, right? The methodologies that the threat actors are using are often similar. The big differential is how do they initially gain access? And as we discussed, it's either through scanning the network and finding a vulnerability in the technology, or through the people. So in this case, this part is a little abnormal. Typically, we see the entry point off hours, but in this case, it was during business hours. A lot of times the threat actors will work on the networks late into the evening, Saturdays and Sundays, because they know there's a less of a likelihood they're going to be detected. But the breach did occur during normal business hours. So we'll discuss that in a little bit more detail when we get into the forensics. In many cases, but not all, there are alerts that can go off at the managed service provider or at the IT company, whatever you want to however you want to reference them. But I will tell you, in a lot of cases, there are no indicators, right? It depends on the quality of the managed service provider and the tools that they've deployed in the environment. In this case for Medicus, they had some tools that were starting to alert that, hey, maybe something's going on here. But I will tell you that probably out of the hundreds of cases we've done, very few times are there any alerts that the network is under attack. Typically, the victim knows they've been hit after it's all over, right? They go to their computers and they see the ransomware on their screen. So the alerts were going off. Once the alerts go off, you have to take immediate action, right? Many times the threat actors will know that they've been detected. Why? It's pretty easy. They'll see IT folks logging into machines. They'll start IT folks will start trying to cut off access, and literally it's a battle, right? It's cybersecurity, folks, IT folks battling the hackers literally in real time. It's almost like a war. So they're alerted that things are going on, and sometimes they may escalate their attack, right? They may make it go a little faster per se. So once we got involved with this, we worked with Medicus to quickly, minimize the damage, right? There was some damage that was done already, but in this case, there was some minimization of the damage. And then once that occurs, you have to start doing forensics, right? So what we're really talking about here is start analyzing the crime scene. Think of it as a detective or someone from the FBI going into a crime scene and saying, hey, let's start gathering as much information about this attack as quickly as possible so we understand what's going on here, right? Understand that as a healthcare entity, you have pretty stringent laws that you're going to need to follow, both at the state and federal levels. So you need to understand, hey, did patient data get accessed? Was patient data exfiltrated? AKA, was it stolen? Who were the attackers? How many systems were impacted? What was the impact to the system? Are there backups available? Things like that. So there's a lot of things that happen. And many folks will say, well, this is like a 2 or 3 day process, right? It's not. Regardless of whether you have 10 computers or 10,000, it's a long process to get through these types of events. In this case, this healthcare entity was hit by a threat group known as Hello Kitty. There's dozens of different types of threat groups out there. New ones pop up every couple of weeks. But their methodologies, the types of attacks they execute are very similar. Most of them are stealing all the data. And then once the data is removed from the network, then they will encrypt all of the data, right? They don't want to encrypt the data first, because then at that point, everyone knows the attack's going on. So typically the final indicator of the event is kind of the skull and crossbones on your screen, indicating you've been a victim. In this case, this was known as the, kind of a triple threat extortion. So typically in a triple threat, we see a couple different methodologies. One is obviously the encryption of the data. That's kind of old school, right? That was where ransomware started. They would just encrypt the data. The hackers would walk away and wait for you to pay. Then they were realizing, well, businesses are getting really good at backing up their data, and maybe we can't always get to the backup. So let's steal the data, especially if it's protected information, personally identifiable information, or electronic protected health information. So they'll steal all the data. And then what they do is, if the healthcare entity refuses to pay, they'll start posting the data on the dark web. And then they'll send a link back to the victim and say, hey, you don't believe us? You think we're messing around? hit this link on the dark web and you'll see your patient records posted, right? Maybe anywhere from 1 to 10% of the data gets posted. So as the victim, you'll go to that dark website, usually with the help of a cyber company, and they'll say, hey, these are your patient records. And the doctors, the administrators, the executives are going to look at that and be like, yeah, those are our patients. And everyone can see them. And I will tell you, some of this data that gets posted, there'll be tens or hundreds of thousands of people that comb through that data. So it's no joke what's going on right now. And as a healthcare entity, you can't afford to have that data posted. So that's part of the triple threat. And then they can also start notifying patients, employees, hey, we hacked ABC Medical Clinic, tell your boss to pay us. Or patient, we have photographs and x-rays on you. If you don't pay us $5,000, we're going to publish these records. So you got to think through this whole process. This is not like it was years ago. This is, a really ramped up environment. So in the end, it was determined that a user had their account compromised. Now, accounts can be compromised in a multitude of ways. An employee could have fallen victim to a phishing or spear phishing email and literally punched in their username and password to the network. It's that simple. And unfortunately, we see a lot of this. We see a lot of networks breached, and we see a lot of email systems breached. And once you give up your credentials, if you don't have certain technology in place to block that, like multi-factor authentication that Steve spoke about before, or two-factor, they're going to get into your network. Exploitation of vulnerabilities, right? That's a huge problem right now, where hackers will scan your network. VPNs can potentially have vulnerabilities. Firewalls have vulnerabilities. Any type of server that's exposed can have vulnerability, software, et cetera. And hackers will sit there and either pick away at the vulnerability individually or combine it with the use of credentials. So in this case, they did have recoverable backups. So, kudos to you folks for having viable backups, because in many cases, the backups are not viable. The hackers will surveil the network, get reconnaissance on it, get into the backup systems and destroy or encrypt the backups as well. So we always tell practices, you can't be 100% reliant on backups, because even if you do have a viable backup, most likely, we saw the slide, 72% of the data is stolen anyway. So they did have backups available, and that does facilitate recovery and helps that process go down from maybe 2 weeks to 9-10 days. But in the end, it's still tough on the organization. And then in this case, like almost every healthcare entity, they had to pay the ransom. So think about that. Tim kind of mentioned this before. Hey, we had their backups for them, but the attorneys and the practice made a decision to pay the hackers in order to make sure the data is not published. That's what it's all about, right? And the hackers know this. And that's the key here is, hey, what do we need to do as a healthcare organization to prevent our data from being accessed and stolen? That's the bottom line here. And a lot of these technologies that are available can actually stop this. Keep in mind, nothing's 100%. But anyway, that's kind of the execution of the attack. And the only thing I want to add here, and just so everyone understands, what ransomware does is it basically locks or encrypts all of the files on the network. Typically, they hit every machine and every server, not all the time. And you sit down at your computer and nothing functions. And in many cases, the operating system doesn't even work properly. The computer's been damaged. And the only way you get your data back is either restore it from backups, or you're going to have to pay, right? There's no magic pink, unicorn that flies in that starts decrypting your data, right? The government doesn't typically have any type of tools, right? You can't call the FBI and be like, hey, I got hit by ransomware. Can you send an agent over to decrypt all this? It doesn't exist, right? The ransom, the encryption is too powerful to break. Some of this encryption will take thousands of years to crack. So, that's the challenge here. Everyone believes that somehow we're going to get our data back.
Yeah, Gary, I think it's important to point out when this process starts, right? As soon as you engage the cyber firm in forensics, as the practice, you lose a lot of control, right? The insurance company is involved, the lawyers are involved, and you're kind of sitting in the back seat at that point, right? So even if your IT department has the ability to just go ahead and restore, right, and recover, The lawyers and the forensics are going to slow you down, right? Because the last thing they want is a quick restore when they don't know what happened, and we're going to have a rinse and repeat. So even though from a technical perspective you may be able to get things back quicker, you're going to have people putting the brakes on you until there's clarity in terms of what happened and ensuring that it won't happen again, which also delays the recovery process.
Yeah.
The good news, right, though, I think, Steve, to this is that if I have done the right things from an IT perspective, when I am able to recover, I'm able to recover quicker.
Yep.
It may take something that's 2 weeks or longer down to 9-10 days, but I'm still down for a considerable period of time. But it sounds like what I'm hearing here is that it doesn't eliminate the fact you may have to pay a ransom. You can have all the backups you want, perfect and restore, but they're going to find a way to get a ransom out of you for one way or another, right?
Yep, that's right. They want to get paid, and they're going to do everything they can through various extortion methods. We've even had situations where the hackers use an anonymous Google phone number and call the executives of the healthcare entity over and over and over again, demanding, right, that they pay every hour, on the hour, 24 hours a day until they crack and pay.
Yeah.
So, they get their cell phones of all the the key employees at those organizations.
Yeah. The other thing too that I'm seeing right now, it seems like 2 years ago, 3 years ago, 4 years ago with ransom, they would negotiate with you on the price. They'd start with a high price and they would negotiate down. Are you seeing that still happening, or is it really they're coming in and they now have all this stuff? It's kind of hard and fast the way it works.
I think it depends, right?
Okay.
Some of these operations are ransomware as a service, where at the top is the threat group that created the ransomware and all the malicious code and the tools to break into networks. Then they sell it almost like a franchise. And the franchisees often can make decisions. Hey, yeah, I asked for 500, but I'll take 250,000 instead.
Okay.
And sometimes at the top level, they'll say, no, that's not acceptable. We won't take 250,000, even though you're a franchisee. So some of them stick to that. They won't negotiate, but I will tell you, most do negotiate.
Okay.
They want to get paid.
Yeah, and I think we've seen too, Gary, where when they exfiltrate data, it's not just EMR data; it's data from their file shares, right? And so we've seen instances where the bad actors actually had copies of the cyber policy and based their demands based on that because they knew what they were covered for.
Which is a good point. Don't store your policy on your server.
We've seen it multiple times.
Of it. Yep.
We've seen crazy stuff. We had one victim that got hit and said, oh, we're a really small company. We don't make that kind of money. And the hackers delivered a copy of their Dun & Bradstreet report.
Yeah.
So obviously the hackers clearly did reconnaissance on the organization and knew kind of how much money they were generating on an annual basis. So I agree with Brian. Don't leave this critical information on the systems. And then, Steve, to your point, HR files, all of these operating types of documents, look, you got to keep them on your network, but the hackers will often take them, right? And then they'll threaten to perform identity theft on employees, on the doctors. We've seen that. They once again, going back to what we said, they will do anything and everything to get the payment.
Crazy. So obviously we've talked about kind of the before and what happened after the attack occurred. Let's talk about the impact it had to the actual practice itself, because I'm sure they're still feeling the pains of this compromise that's happened. So Steve, you want to walk through some of the things that happened from the initial?
Yep, sure. And I want to be, cognizant of time too, right? We want to make sure we have enough time for Q&A. So, the initial impact, as we mentioned earlier, the EMR was down for 9 days, meaning it was 9 days before they could actually start entering data into the EMR again. Fortunately, they had offsite backup, so we were, they were able to access an offline copy of the EMR to pull schedules and things like that. So they weren't completely blind, but the team couldn't actually access or input data for 9 days. Email is down for 3 days. And a lot of that is actually intentional, because of the bad actors. They actually monitor the email communication. So you want to shut that down because you don't want them, having the details of what you're doing and how you're responding in the background. And for this practice, it took about 30 days for them to get fully back online. They had some older hardware, right? So they had to go through the process of actually replacing some devices, and with supply chain shortages, they ran into some issues on getting, the hardware that they needed. So, kind of that double whammy there. And then I think this piece gets missed. People don't pay attention to this enough, the management stress, right? The stress on the team during this event and after this event, right? There is so many balls coming flying at them at once from, legal, forensics, IT, their team, the doctors, right? There's a tremendous amount of stress on the team. And the team better be well prepared, right? So that they know how to communicate. They know how to communicate with their team, with their patients. They make sure that they have a paper process so that they can continue to see patients and not lose all revenue. But of course, initially all that stuff is gone, right? And if you don't have the processes, right, again, it's people process, you're gonna suffer longer. And then the ongoing impact, right? So this client had 44,000 patients that had to be notified, right? A lot of work. And I think that's a whole nother side conversation, right? With the EMRs and all the data that's in there. A significant majority of those patients were legacy patients, right? Patients they haven't seen in greater than 7 years, but because it was in the EMR, they had to notify. But yeah, they had to, manage all those calls, the questions from the patients. They had to implement credit monitoring for their employees because HR files were stolen. They had to deal with cash flow issues. They had to deal with insurance claim, ongoing legal calls, and now OCR investigation, right? So that's part of the process as well. And then just the ongoing internal management team distractions, right? It's just the tail of this thing goes on for years.
Wow.
And Steve, I think you bring up a really good point. No one ever wants to talk about the human impact, the mental and the physical stress that this causes. I've seen doctors break up partnerships over these types of events because they don't agree on how to resolve the issue. I've seen administrators and executive teams quit, right, in these types of events. And the stress on the staff is crazy, right? They're taking the brunt of this. The phone calls from the patients, the doctors, basically saying, hey, you go deal with this. I got to figure something else out, right? That's a tremendous issue. And then what I also hear, believe it or not, is a lot of doctors and administrators suffer from PTSD, right? This is one of the most life-changing events they're going to go through because they're watching their livelihoods disappear in front of them. Yeah. And typically around the year of their anniversary, kind of the panic sets in again. We see it all the time. Victims that utilized us will call us around the 1-year anniversary. What else do I need to do? Am I going to get hit again? It's kind of the anniversary of this, and it's a problem, right? And it's really sad, frankly, to see what actually happens. It's the victimization of these events. It's not so much just a financial transaction. It's everyone, the hackers getting into kind of everything you do and how you do it. And doctors will say, you mean they read all my emails also? That's a tough pill to swallow.
This is a good spot to address. I'm always asked from my clients, how much limits should I buy from cyber insurance perspective? You can see a lot of things on this slide. You see notification costs. We already talked about the cost of notifications. You see credit monitoring. That's all involved in the cost of notification. Loss of revenue. And when we say loss of revenue, it's loss of profit. A lot of times, a lot of insurance brokers say business interruption insurance. Well, it's really to cover your profit, loss of profit, not loss of revenue. So just a very, very easy distinction to make. The legal aspect. Somebody posts information anyway after you've made a payment, or they heard about the breach. Anybody can sue anyone. And a lot of times when you're thinking about a limit, is $1 million, is $2 million enough? It may not be enough and you may not be able to afford enough insurance, but all of these things here go towards that discussion. And it really comes down to risk appetite and what you're willing to pay for and what you're willing to stomach. One thing that we haven't talked about that didn't happen here, but there are certain insurance companies which will provide sub-limited coverage for bodily injury claims arising out of healthcare. So I read about a case where that the bad actor went in and actually threatened to change medical records if they weren't paid. And if they did that and it created a subsequent bodily injury that would typically not be covered by your cyber policy, it would not be covered by your general liability policy because it arose out of a cyber breach unless you had coverage for it. So just one more thing to think about and ask your broker about is, do I have bodily injury coverage arising out of my breach?
I think the other thing, Brian, that a lot of people, when they're looking at their cybersecurity, they're thinking about the ransom, they're thinking about kind of the remediation efforts, but you need to take a step back and look at the whole process that happens after the compromise, and then determine what you think you need, and then determine your risk, how risk adverse are you, and what you need to put in place to protect yourself.
Sure. Yep.
So we'll just kind of summarize here on the last thing. So what were some of the lessons that were learned that came out of this breach? And Steve, why don't you take the lead on this and kind of just talk through what some of the lessons were learned and what we want our audience to take away from this.
Yeah, and this is lessons learned / shared, right? Because I think as we said up front, the practice did have some of these things in place. They want to emphasize to others through this as well. But this one happened to me is not a strategy, right? As we learned earlier, it can happen to everyone. Really important to have those manual processes in place. I think that was key to, getting through this and managing the stress levels of the team. It's like, hey, we have a plan in place, right? And this is not just for cyber, but this could be for other outages where you can't get to your EMR for whatever reason. Developing a communication plan without having email or chat, right? Because it's going to get shut down, right? So how are you going to communicate with your team, especially now with, a percentage of your team potentially working from home, right? With COVID and some other things, we now see a percentage of healthcare practices that have people working from home. How are you going to communicate with them? The big thing was, note taking during the incident, right? There's a lot of balls in the air. You're going to have to, answer a lot of questions posed by legal and everybody else. So make sure you're taking your notes and know who's going to be responsible for logging things and consolidating all the notes as you go through this. Obviously, reviewing your insurance annually with qualified people, right? Have a major discussion about it. And then, this is an ongoing risk, right? And understanding, your attack service as a practice, right? What can be attacked? We're seeing a lot more of Internet of Things, a lot more devices, right? And mitigating risks. It's changing almost on a monthly basis, right? So you can't create a plan and assume that it's going to be fine for the next few years, right? It's got to be ongoing. And then, make sure you've got your policies, procedures, risk assessments, right? It's critical to managing the OCR response, right? Because at the end of this, as if it wasn't bad enough, now you got the OCR, in your business, asking all these questions and making sure you did what you were supposed to do.
Steve, just so the audience understands, OCR is the Office for Civil Rights, right? When these patient records get compromised, it's a civil rights violation against the patients.
Yeah.